As someone who attempts to take at least moderately adequate care of our health, I've always had immense respect for doctors and all of their seemingly unwavering professionalism. That's why I was so horrified when I went in for a routine checkup one morning and the doctor stumbled in 15 minutes late while cramming down a Baconator, which he mentioned was great for hangovers. The whole time I kept staring at his grease-covered gloves. I couldn't stop shaking because, I'm sorry, it's my first time. This fool was so out of it that in the middle of the breast exam, he mentioned, "You know, you remind me a lot of my ex." I thought about suing him for alimony payments, but it didn't feel like the right time. Honestly though, while I realize this may be an extreme case of doctoral incompetence, this scenario is unfortunately not as unthinkable as we'd hope. After all, according to Cook's 2017 study, half of all medical students experience burnout. And as Dr. Dave Liu pointed out in 2015, burnout results in greater rates of inferior medical care for patients. Not that I needed a peer-reviewed study to figure that one out. In order for us all to figure out what exactly is going on with our doctors, though, I will first examine the causes of burnout. Next, I will dissect its true effects before finally stitching up this issue with some solutions. Before getting into any of that, though, let's go over what exactly burnout is. Burnout, as defined by my mother, is when you flunk out of college and spend all day smoking weed and eating Cheetos. However, the 2016 issue of the Korean Journal of Medical Education says the symptoms of academic burnout include physical, emotional, and psychological depletion due to fatigue, frustration, distance from study, stress, helplessness, and cynical attitude as a result of academic overload. This version of academic burnout is actually pretty common in med school, since students have to deal with significant academic, environmental, and interpersonal stressors. However, the one cause of burnout that did surprise me was that apparently in med school, professors employ an off-brand Socratic method known as pimping on students. Now, pimping, this is so messed up. So, you remember the first day of potions class when Professor Snape started asking Harry all these crazy hard questions they had no way of possibly knowing the answer to? Right, you remember? Well, apparently they do that in med school. They'll ask all these impossible questions on purpose so that they can publicly humiliate you on purpose. And while I think we can all agree that is hilarious, Karen Scott et al. Actually showed in 2015 that this form of teaching has negative impacts on students' mental health. Now, I know what you're thinking. Pimping causes mental harm? But that hooker behind Wendy's seemed perfectly sane. And again, Baconators are a great cure for depression. Unfortunately, as Rohan Puthran pointed out in his 2016 study, most students choose not to seek out legitimate psychiatric care from the combined effects of burnout and pimping. Which does actually make sense, considering that a box of wine will always take your calls at 3 a.m. Sadly though, the cumulative effects of medical students' mental burdens do not remain quarantined in the classroom. Burnout harms everyone, and the effects, just like my physics grades, are disappointing but not surprising. According to a 2017 article published by the National Academy of Medicine, or NAM, burnout is an independent predictor for reporting a recent major medical error and being involved in a medical malpractice suit. Just to put that in sheer economic terms though, the cost to replace just one burnt out physician can be up to $1 million. And for all of you thinking, wow, that sucks. But ignoring the healthcare cost, I think I'll be fine as long as I stick with my doctor that Yelp says is 5 stars, knew all the doctor words, and didn't boo hunt me once. Besides, if worse comes to worse, I can always just see a nurse. About that. According to that same article published by NAM, 43% of nurses are experiencing a high degree of emotional exhaustion. And they experience depression at a rate double that of the national average. And again, just to point out the obvious here, as their exhaustion and burnout increase, their interest in you decreases, along with their interest in finding the right vein the first time, or the second time, or the 15th time. It all becomes relative. Basically, don't expect their empathy to be that high if you're going to be little miss greedy and not share any of your morphine. However, bringing it back to the effects for everyone who somehow still wants to be a doctor. Goldhagen reported in 2017 that burnout in medical students results in decreased life satisfaction, serious thoughts of dropping out, and suicidal ideations. In fact, as Rohan Pukran pointed out in his 2016 study, male and female physicians, that's sexist. Female and male physicians experience suicide rates that are 130% and 40% respectively higher than their counterparts in the general population. Still, despite all these horrifying statistics, I don't want you all to walk out of here thinking that hazing has no benefits. Ask any frat brother, hazing is a great technique to get freshmen to shave your back hair. Unfortunately, its effectiveness as a teaching strategy is just not as stellar. At the risk of becoming repetitive, I must remind you all that half of all medical students experience burnout. But while burnout in the medical profession may be an epidemic, it is not incurable. In order for this problem to truly be excised from society, though, everyone, even remotely involved with the medical profession, must take a stand. Even though the biggest solution is just not letting med school faculty haze the freshmen. They don't let the football coaches do it. They don't let sororities do it. There's no reason for med school professors to do it. To which many of them would undoubtedly respond, but hazing ensures that students study hard. But guess what? There already is a structure in place to ensure that students study hard. It's called midterms. However, if professors would like to change med school culture itself, they can do so by providing stress management programs, mentorship programs, and extracurricular activities. Now, while the first two are hopefully self-explanatory, some of you may be wondering how cramming in time for a hobby into an already jam-packed schedule will somehow alleviate stress. And while I agree that may seem counterintuitive at first, a 2016 article published by the National Center for Biotechnology's Institute, or NCBI, confirmed that extracurricular activities are associated with decreased burnout and stress levels in medical students. Plus, students don't even have to have the faculty's permission in order to enjoy the benefits of having a hobby. In fact, if you don't have one, I can suggest one for you right now. Practice origami. Hell, I've been practicing all year. You see it? It's a crane. I made it after my professor said she doesn't curve. Anyway, as for all of you becoming understandably frustrated and thinking, but seriously, how can I ensure that my future doctor doesn't accidentally kill me? Good question. The Initiatives tab for the NAM website addresses this dilemma by illuminating numerous different topics regarding burnout that must be further researched in order for this growing problem to be resolved. If you would like to help ensure that these topics are further researched, you can donate to the cause by scanning that QR code or just going to the National Academy of Medicine website. Also, if you would like to further educate yourself or a friend, you can go to Twitter and search the hashtag #ClinicianWellbeing, which will bring up numerous different articles regarding medically related burnout. However, regardless of your choice, I hope we can all at least agree we must keep pimping out of medical schools where it doesn't belong, and behind Wendy's where it does. Even after learning of the symptoms of burnout, diagnosing the effects, and determining the appropriate treatment, I still dream of becoming a doctor one day. However, I question what kind of doctor I will become. Will I make it through the horrors of medical school with my sense of self intact? Or will I stumble out looking as haggard as that boob-honking doctor, too exhausted to even realize that nutritious breakfasts don't typically include Baconators, aka the leading cause of heart disease? Still, all things considered, he's not the most incompetent of doctors. After all, that's not the worst disease a burnout's ever contracted at a Wendy's.